All right. It appears that we are live again, and I'm back, Greg Cox, helping to moderate this afternoon. This afternoon we have Dr. John Taylor with us, and he is the Director of Neurological Services and a staff neurologist at Midcoast Medical Group at Midcoast Hospital in Brunswick, Maine. And we're really excited to have him because he is the director of the Midcoast Hospital ALS Clinic. And we really want to know what goes into the ALS Clinic, what are the benefits for the patients and the local caregivers as well. So thank you very much, Dr. John Taylor.
Thank you, Greg. I assume everybody can see me at this point. So we're going to talk about the ALS Clinic and benefits of the clinic. And like Greg said, I have the ALS Clinic here, the only ALS clinic outside of the VA system in Maine. So the first thing I just want to start off with is a shout out and a thanks to the ALS Clinic team. So you can get an idea that the ALS Clinic is a team of people because here they are. And we're going to be talking about these people sort of individually as we go through this slide presentation. So a little bit about the clinic. So the ALS Clinic in Maine here, we started just about 4 years ago. At any given time, we have around 35 patients, maybe 40 patients. And our catchment area is pretty much involves the western part of Maine, though very far west may go over towards Dartmouth. Southern Maine probably heads down more towards the Massachusetts area, but we have everything to the north and sort of the northwest of Maine and everything along the coast for the most part. So one of the benefits of the ALS Clinic is, and having such a sort of a large state with a very diverse population of people, is that we develop relationships across the state with other vendors of equipment. So we know, for instance, who might be able to do wheelchair evaluations or who offers reasonable home services or hospice providers. So pulmonologist, for example, we use Dr. Nowak up in the Bangor area quite frequently. So we've developed relationships with providers in other areas that can help us care for our ALS patients, and they in turn have some expertise and interest in taking care of folks with ALS. And Midcoast, just so everyone knows, is a member of the Maine Health System, so we collaborate up and down the coast with the other Maine health hospitals. So it is a multidisciplinary clinic. So just a brief overview of what we're going to talk about today. We're going to just define a multidisciplinary clinic. Then I'm going to talk about what those disciplines are, how they're involved. As Greg said, sort of a little bit about the importance of the clinic, the potential benefits to the person with ALS, and importantly, the caregivers of the people with ALS. Another potential benefit to a clinic, not necessarily our clinic, and I know you heard about this earlier, is access to clinical trials, but we don't do clinical trials here in Maine. We're not part of a big research-based center. So a definition of a multidisciplinary clinic, came up with this the other day as I was sitting thinking about it. So an ALS clinic coordinates multiple types of medical providers to address the medical, physical, and emotional needs of ALS patients and their caregivers in a single setting. So the idea here is to have one-stop shopping. So you can come to one place and have your needs met. So the idea is that a patient is in a room, the person with ALS in a room with their care providers, and the various people that work at the ALS clinic then rotate through that room at intervals. So the patient gets to see all of the various disciplines at intervals in that one setting. So, and we coordinate care. So there's a pre-clinic meeting and a post-clinic meeting. So before we meet, we talk about each person that's going to be there individually, what may have gone on since we last saw that patient, or an overview of that patient if they're new to the clinic, and what things we may want to be addressing during that clinic. And there might be multiple providers involved in that issue. So it might be an issue with nutrition. So speech therapy would be involved. Speech therapy would be involved along with the nutritionist. And I might get involved in that because we have to order certain products or whatnot, or we might be talking about a feeding tube. So there is a coordination of care at that clinic, which makes it very nice. So what are the disciplines here? Again, in no particular order. So the ALS Association Care Coordinator is going to be there. So our care coordinator is Lori McFerrin. I'm sure some of you know Amber Stalker. She's also a care coordinator in different areas over towards New Hampshire. We have a physical therapist, an occupational therapist, and a speech therapist. So these are the same people each time. So it's not like a rotating physical therapist or a rotating occupational therapist. It is a dedicated physical therapist to the clinic. Same thing with the nutritionist. We have social work. I have 2 nurse managers here who are involved. They rotate going to the clinic, and they're here in the office helping answer calls from patients of the clinic and coordinate care. And then there's a neurologist, myself, and if we ever get rid of COVID, we'll get back to having a respiratory therapist. Respiratory therapist helps with doing some breathing tests, talking about their non-invasive ventilation, stuff like that. But as of yet, we cannot do any aerosolizing procedures. So we don't have a respiratory therapist, and they're, quite frankly, all very busy in the hospital with COVID patients. So they're needed elsewhere. The importance of a multidisciplinary clinic, there have been quite a number of studies done over time showing that it improves the quality of life, and it can also improve the quantity of life. And that's largely just through the coordination of care. And number 3 here, the anticipation of needs. We know that if people get their feeding tubes earlier, if we're addressing their breathing needs earlier, then there's just a great benefit to the patient, both in terms of, again, their quality and their quantity of life. There is coordination of resources. Like I was saying earlier, we develop a lot of relationships with other vendors, other providers, so we can help coordinate that, in addition to coordinating amongst ourselves, right? So we want to make sure that physical therapist, the occupational therapist, and myself and nursing, we're all on the same page of the book when we're making certain recommendations for folks, because we don't want to be confusing people. We want to provide the best coordinated care as we can. There's access to expertise. So everybody has been to courses. We've been doing this for a while now, so we developed some expertise in this. So the clinics do offer some access to expertise. To the individual person, what are the types of things that we may be addressing? So I think you heard about the platform trials and AMX 0035 earlier, and we're all hoping and looking for treatments. And I really don't like it when people say, oh, ALS is incurable or untreatable, because it certainly may not be curable per se, but it certainly is treatable. The symptoms are treatable. So the focus really is on symptom management. So we're talking about speech and communication devices. So Kristen, the speech therapist, has really gone out of her way and developed an expertise in the voice banking and the computer software, as well as the hardware that people are using, and what she can recommend, help with the devices. She has a number of them in her office sitting there for people to look at and try out. And that also includes other devices, tablets, amplifiers, voice amplifiers, and nutrition focuses on weight management, appropriate foods. We'll help talk about feeding tube placement and that what feeding tubes are appropriate and in what quantities. Secretion management can be a big one. Cough assist device, suction devices, how you go about thinning out secretions, either with medications or non-medical means through water. Just increasing hydration sometimes is very helpful. We'll talk about pseudobulbar affect, that inability to control emotions at times. Laughing at things that aren't really funny can be very disturbing to patients. So there are a number of medications on the market that we try. Weakness, again, talking about adaptive equipment, energy conservation, spasticity, that increase in tone that people have, that they get very stiff. So there's tone management with physical therapy recommendations, medications that we may use again, cramping, stretching techniques, medications, difficulty breathing. We're talking about non-invasive ventilation, appropriate referrals. We work with pulmonologists all over the state in this respect. Other button. A thing that years ago we taught, we were taught when I was in my training, ALS doesn't affect cognition, but we know that 35-40% of people can have some cognitive impairment. So recognizing that, counseling people, talking about appropriate medications, very important. Depression, bowel and bladder. Our physical therapist also has a great interest in women's health and bladder and bowel health. So she has a lot of experience in that realm as well. Also very helpful. Mobility, of course, power wheelchairs. Again, this is anticipatory. These things take 3 to 4 months potentially to get ordered and have them built and get them delivered. So you've really got to be anticipating what people's needs are before they need something, because once they actually need it, it can take quite a while to get it. Other equipment that you can see there, we try and address sleep and sleep hygiene, and of course end of life wishes. We do posts. There's a lot of other things that generally tailored to the individual patient or the patient's caregiver, right? So we know where the support groups are. Lori runs the support groups. Out of our chapter, we've developed some mind-body medicine workshops for people with ALS and their caregivers. There are caregiver workshops that go on that are coordinated to a certain extent with some of our providers. Organizations, end-of-life discussions when appropriate, hospice care when appropriate. Of course, discussions about death with dignity have been something that's been coming to the forefront over the past year. So you can't talk about the benefits to people with ALS without talking about the benefits of the people that take care of the people with ALS. Really important folks. It takes a village to care for somebody with ALS. I'm sure everybody on here knows that. So we have some access to programs specifically for caregivers. We've got emotional support resources. And of course, it's a resource for questions and answers for family members and the caregivers themselves. So that's about what I had prepared, and I'm happy to take some questions at this time.
All right. Thank you very much, Dr. Taylor. So while we're waiting for some folks to provide some questions, I'm really impressed with the fact that you have this entire team put together and that it's the same, there's a continuum of that team with the patient as they're progressing, because the fear of going to new specialists over and over, and you always have to start from the beginning and start fresh, and they don't know your history. And so having the access to that many specialists that know you and your disease course is so impressive.
Mm-hmm. That is definitely what we strive for. When you show up, we go through our pre-clinic meeting and post-clinic meeting, we are picking up where we left off, not at the beginning. So we're knowing last time you were here, we were having some issues with whatever, or we ordered this piece of equipment, or we asked you to see this provider, or you got your peg tube placed, and now we're going to, address everything that needs to be done with that. So.
Right. We heard the talk before from Dr. Jill Yursak. One of the things she talked about was education for physicians in helping to get to an ALS diagnosis more quickly, and to get access to the information to actually make those diagnoses. Have you seen any improvements from the local physicians or the neurologists and the specialists that you really need to get this diagnosis? Have you seen any improvements in that system?
I think what I've seen probably over the last couple of years, as the word's gotten out there, we are getting more referrals into the clinic. I think it took some time actually just to know we were here. I do think there, as people do not like to make the diagnosis of ALS, and so there's a lot of waiting to make sure you really got it right. You know what I mean? And that's clearly not necessary, and it's sometimes we're wasting some valuable time that we can get some people going on whatever trajectory and whatever pathway we need to get them on.
Right. But one of the questions here is about how does someone get referred to an ALS clinic?
You can talk to your primary care provider or whoever, and they can put in a referral over to us. I get them from Dr. David down at Mass General, all the way up to whoever the providers are up in northern Maine.
Right. And so I guess that's part of it is, how many people, as they become more aware that this clinic exists, they can help make those referrals, because otherwise it's the patient having to bring that information to their primary care provider. All right. It looks like we're just about at the end. Do you have any final thoughts that folks can take away from your discussion?
No, I'm just happy that I was able to get on here and let people know about our clinic and the importance of clinics. And I think they really are important for folks in terms of coordinating their care.
Very good. Thank you so much. I know that's really helpful for our newly diagnosed patients, and those who have been through this journey certainly know their way around these ALS clinics. So I'm glad to have you here with us today. Thank you.
Thanks.